The news of Michael Jackson's death on June 25, 2009, sent shockwaves around the world. For many, it was impossible to believe that the king of pop, the global icon who had captivated audiences with his music and dance for decades, was gone. The initial reactions ranged from disbelief to profound grief, and the questions began almost immediately. How did he die? What really happened in those last moments of his life? Dr. Christopher Rogers, a seasoned forensic pathologist with the LA County Coroner's Office, was tasked with uncovering the truth. He had been with the coroner's office since 1988 and had performed thousands of autopsies, many on celebrities. But Michael Jackson wasn't just any celebrity. He was a phenomenon, a man whose influence extended far beyond the music industry. The pressure to provide answers was immense, and the world watched with bated breath. When Dr. Rogers began his examination, he noted that Jackson's body, unembalmed and refrigerated, appeared to be that of a thin, 50-year-old black male. The singer weighed 136 pounds and measured 69 inches in length. Despite the physical appearance of someone who had struggled with health issues, Dr. Rogers was surprised by the overall good condition of Jackson's body. There were some minor health concerns, such as an enlarged prostate gland, vitiligo, a polyp on his colon, and some lung scarring, but these were not significant enough to explain his death. One of the most striking findings was the health of Jackson's heart. At 50, it was expected that Jackson would have some degree of coronary artery atherosclerosis, a common condition in middle-aged men. However, his heart showed no signs of this or any other cardiac disease. This was unusual, especially given the singer's history of drug use and the intense physical demands of his career. Dr. Rogers also noted that the only signs of trauma were the result of the desperate attempts to save Jackson's life, including bruising from CPR and cracked ribs. The autopsy also revealed a significant amount of cosmetic surgery and tattooing. Jackson had dark tattoos around his eyebrows and lower eyelids, and his lips had a pink tattoo. These cosmetic alterations, along with the numerous scars on his face and body, suggested a long history of plastic surgery. Scars on his arms, wrists, and torso indicated various medical procedures, including possible Roman IV treatments and liposuction. The most significant scar was on his scalp, where a tattoo had been used to cover up the effects of a severe burn injury from 1984. Despite the detailed findings, Dr. Rogers could not determine the cause of death from the external examination alone. The presence of prescription medications and the numerous puncture marks on Jackson's body suggested that drugs might have played a role, but the toxicology tests would be crucial in confirming this. The chief investigator for the Los Angeles County Coroner's Office, Craig Harvey, stated that there was no evidence of trauma or foul play, but the final ruling would have to wait for the test results. As the news of Jackson's death spread, theories and speculations began to circulate. Some suggested that the singer had faked his death to escape his financial troubles, while others believed that he had been the victim of foul play. The most plausible theory, however, centered around the role of Dr. Conrad Murray, Jackson's personal physician, who had been with the singer on the night of his death. Dr. Murray, a cardiologist, had been in charge of Jackson's medical care during the final months of his life. He had been tasked with ensuring that the singer was fit enough to perform a series of comeback concerts in London, but his relationship with Jackson was shrouded in mystery. The Jackson family had never met Murray, and there were questions about his qualifications and the nature of his care. On June 25th, the day of Jackson's death, the Los Angeles Police Department LAPD attempted to contact Dr. Murray, but he had disappeared from UCLA Medical Center and was unreachable. It wasn't until the following day, June 26th, that Murray's attorney, Michael Pina, reached out to the LAPD, suggesting a meeting on June 27. The Jackson family, meanwhile, demanded a second autopsy, hoping that it might provide answers more quickly than the official investigation. The meeting between Dr. Murray, his attorneys, and the LAPD took place at the Ritz-Carlton Hotel in Marina del Rey. During the 3-hour interview, Murray provided a detailed account of his relationship with Jackson and the events leading up to the singer's death. He described how he had met Jackson in 2006 and had been asked to be his personal physician for the London tour. Murray admitted that he was aware Jackson was taking sedatives, including Propofol, a powerful anesthetic that Jackson referred to as milk. On the morning of June 25th, Murray claimed he had given Jackson a 25 mg dose of Propofol, and the singer had fallen asleep. When Murray returned from the bathroom a few minutes later, he found Jackson unresponsive. Murray described his frantic efforts to revive Jackson, including performing CPR and calling 911. He also mentioned a bag he had placed in one of Jackson's cupboards, which contained the medical equipment and medications he had used on the final night. This bag would later become a key piece of evidence in the investigation. The toxicology report, which was released several weeks later, confirmed that Jackson had died from acute Propofol intoxication, with other sedatives, including lorazepam, midazolam, and diazepam, contributing to the fatal outcome. Dr. Murray was subsequently charged with involuntary manslaughter and was found guilty in 2011, serving 2 years in prison. Michael Jackson's death was a tragic end to a life marked by unparalleled talent and immense personal struggles. The world may never fully understand all the factors that led to his passing, but the investigation and subsequent trial shed light on the dangers of drug misuse and the responsibilities of medical professionals. In the end, the legacy of Michael Jackson remains a complex and enduring one, a testament to his artistry and the profound impact he had on popular culture.